At present, the world has to encounter the problems of climate change, environmental degradation, disasters, and epidemics of emerging and re-emerging diseases, which are common health problems of many countries. For Thailand, the guidelines for responding to both groups of diseases affecting people's health have been developed, including the systems for disease surveillance, prevention, treatment, and control under the One Health concept. For example, working collaboratively in a multidisciplinary manner among officials in the human and animal health, as well as environmental sectors. Moreover, actions are ongoing regarding the development of capacity and preparedness of the management system, as well as personnel and knowledge management for efficiently preventing and controlling communicable or infectious diseases, according to the internationally recognized standards. Lop Buri, strong SRRT at the sub-district level. The Aedes mosquito larvae control project has been carried out for a long time, but the danger from dengue hemorrhagic fever remains enormous. The control efforts should be seriously made so that the danger from the disease will be lessened. An excerpt from the royal speech made by His Majesty the King, 24th August 1999. Lop Buri, located about 150 kilometers north of Bangkok, is a province with a lot of economic and tourism activities. The province has got several well-known tourist attractions such as Pasat Chonlasit Dam, King Narai's Palace, 3 connected pagodas, and sunflower fields. The largest one in Pattananikkom, a district in Lop Buri. Here is where a case study on the development of an efficient disease prevention and control system through multi-sectoral cooperation is conducted. Dengue hemorrhagic fever, a communicable disease transmitted by Aedes mosquitoes, is a major public health problem that has continuously affected people's health. Today's War Room meeting is held with representatives from all sub-district health-promoting hospitals in Pattananikkom district to inform them of the outbreak of dengue hemorrhagic fever, DHF, and to draw up a plan to control the disease. One of the innovations, which is the highlight in this district, is the application of the information technology, especially for disease warning purposes, for all diseases in the district epidemiological surveillance system, called VEP Alert, based on the principles of rapid recognition, rapid notification, and rapid containment. The system helps reduce the number of steps for dealing with disease reporting. When a DHF patient is found, the case reporting can be done online immediately to relevant agencies with a warning sound, together with a pop-up text on the computer screen saying please accept a case. And then there is a warning sent from the hospital to the sub-district health promoting hospital and vice versa. Hong Sak Bun Tat, Health Technical Officer, Pattananikkom Hospital, the VEP Alert System Programmer, said that the system has been designed to eliminate the problem of non-coverage of case reports. Sometimes there were a lot of patients. The nurse might not notify the hospital's epidemiology unit of a certain case. then the case would be missing, resulting in the ineffectiveness of the disease control effort. The new system will double-check whenever the doctor diagnoses the patient with dengue hemorrhagic fever, and a certain place has to be notified. Be sure that the case report will be definitely sent to the local level. The system will help increase the speed of reporting and lessen the redundancy. If the operating official is not at the computer workstation, within 30 minutes, a SMS warning will be sent to the responsible official to know that there has been a case.
ภายใน 24 ชั่วโมงเราก็จะใช้เกณฑ์ตัวนั้นซึ่งเราก็จะปรับเวลาในส่วนของตัวระบบ alert ว่าจะให้ alert เร็วขึ้น
At the multi-purpose building of Dilang Subdistrict, today's meeting deals with the preparedness for the prevention and control of dengue hemorrhagic fever of the Subdistrict Surveillance and Rapid Response Team, SRRT. The meeting's attendees include district and sub-district health officials, community leaders, and village health volunteers. They all take part in designing a plan for the surveillance and prevention of dengue hemorrhagic fever in their communities. Village health volunteers and SRRT, or network members at the sub-district level, are the key persons dealing with disease surveillance and preliminary actions. To control the disease outbreak, the team members will play their assigned roles properly, as they have already been trained to perform such tasks. They are the key workforce, as they know the locality and understand the villagers' problems, and can get closer and have better access to the community than the health officials that are just a few in numbers. The health volunteers and network members are the villagers who voluntarily work for the community. Here is the dairy farm of Lop Buri, the village headman of village number 6 in Dilang Subdistrict. Lop and his wife not only do the milking for sale every day, but also spare some time to serve as village health volunteers.
รายละแวกบ้านตนเนี่ยเป็นแน่ก็จะมารายงานให้กับผู้ใหญ่บ้านทราบผู้ใหญ่บ้านก็จะรายงานไปทางให้กับ
Lop Buri, village headman, village number 6, Dilang Subdistrict, and a village health volunteer on the subdistrict SRRT, said that disease control could not be done only by health officials, as it requires the cooperation of all sectors, with readiness in terms of workforce, supplies, and equipment, so as to carry out the disease control operations more rapidly and efficiently. My wife and I have volunteered to get involved in this matter, as we deem that it is beneficial for the people in our community. It is also challenging to make the people know and participate in disease control.
ด้านอุปกรณ์ด้านกำลังพลก็จะดีขึ้นครับการควบคุมโรคก็จะได้รวดเร็วและได้ประสิทธิภาพ
At the office of the Dilang Subdistrict Municipality, today there is a monthly meeting of community leaders, sub-district headmen, village headmen, village health volunteers, representatives of private businesses, and health officials to discuss all the problems of the locality. The meeting agenda includes the situation report on the outbreak of dengue hemorrhagic fever, so that they all will be informed of such a situation and help to find ways to solve the problem. Somchai Tum Dirang, Mayor, Dilang Subdistrict Municipality, said that the decentralization to local authorities is advantageous, as they will have the budget and the operations can be undertaken rapidly and timely to resolve local problems. Local organizations give high priorities to people's livelihood and health issues and are ready to support and cooperate with the health sector in resolving health problems. The campaign to raise public awareness is one of the proactive operations collaboratively undertaken by the Dilang Subdistrict Municipality and the Dilang Subdistrict Health Promoting Hospital during the serious outbreak of dengue hemorrhagic fever. Campaign activities are carried out in the communities, factories, schools using the slogan, "Dengue hemorrhagic fever is fatal. If there are no Aedes larvae, there will be no dengue hemorrhagic fever." The outbreak control methods include closing all water containers, releasing larvivorous fish guppy to eliminate Aedes mosquito larvae, and cleaning the environment to eliminate mosquito breeding places every 7 days. To warn and inform the people about the outbreak of dengue hemorrhagic fever, the municipal office will send a chemical spraying team to do the anti-mosquito fogging within the 100-meter radius of the source of infection.
หลักคือต้องเป็นที่นายกเราก็จะต้อง
Apichat Po Hom Sili, Director, Dilang Subdistrict Health Promoting Hospital, said that the key success factor of the disease control in this subdistrict is the administrator's attention to this problem. All administrators at the provincial, district, subdistrict, and village levels give importance to the disease control and have set the policy in the same direction. Multi-sectoral cooperation is essential in planning, implementing, and evaluating the disease control operations, and all take responsibilities for their tasks, especially in thinking, developing, and improving the systems to be consistent and favorable to the work.